Hi, my name is Lisa Rodriguez, and today I would like to give you a little insight into medical billing. Remember the last time you went to the doctor's office, and as you were leaving the room, the nurse gives you a piece of paper to take to the front desk with lots of numbers, lots of abbreviations, and you really didn't have a clue what they meant? Well, I thought I'd take a few minutes today to share with you what medical billing entails and what those numbers actually mean. And the piece of paper that you get, by the way, is called a super bill. I'll be breaking down the basic concepts, hopefully to give you a little better understanding of how it all works. And with the medical billing skills that you have acquired, you can also take it in a variety of directions. I'll briefly touch on the opportunities, but mainly concentrate on the usage of the codes, processing the claims, and the explanation of benefits. Let me first begin by explaining what the numbers of the codes represent. CPT is an acronym for Current Procedural Terminology, and it is a 5-digit coding system that depicts the procedures and the types of service, or the specific services. It includes 6 main categories, and that would include the E&M services, which would be your office visits, anesthesia, surgery, radiology, pathology lab, and medicine, which is used more for the administration side of drugs rather than the actual drug codes themselves. The American Medical Association revises this annually, and they are the ones who produce the CPT manual. And this is what that would look like. Pretty thick book, lots of information. The ICD-9-CM, which would be this manual here, the acronym means International Classification of Diseases, the 9th revision, clinical modification. They are 3 to 5 digit codes, and they represent the diagnosis as well as underlying causes. They're also included in that V codes, and they are a supplementary classification that is used when illness is not the reason for the encounter. There are also E codes, and they are external causes, and those are used more so to break down if you was in a car accident or drug overdose, that type of thing that would give more specification to the circumstances. There's also another book of codes that's called HCPCS. Now, I don't have that one to show you. It is now required since the HIPAA law came into effect, but it hasn't always been used nationally. It was more used for hospital purposes. Because they are, or rather a federally funded program requires these codes now, and they do reject the claims if you don't use them properly. They also are 5-digit codes with an alpha character in the beginning. So having a good understanding of how these manuals work and how the codes are used is vital, of course, to producing a clean claim. The term clean claim means that you have submitted the claim free of error and it is a payable claim. It is very important to put your codes on there properly and in a specific order. Your office visit always would go on there first, and then any procedure codes that might be done at that same time of encounter would follow, using the higher dollar item as your first code and then proceeding downward. Doctors usually do the coding, however, at least they do in our offices. They know specifically what procedures they have done and accomplished, so they generally select the codes themselves. However, if there's something that they've done that they're not finding quite the right code for, they might come to me and ask me to find it for them. Modifiers is another type of code. It's a 2-digit code that would be appended or added to the end of the procedure code. And it basically is a geographical type of code. It's 2-digit. It would depict whether it was left, right. There are specific finger and toe modifiers for specific procedures, and even codes such as depicting medical necessity. So after submitting your claim and receiving the payment for the claim, you also receive what is called an explanation of benefit. It's also referred to as an EOB, and it's kind of an interchangeable term with a remittance advice, which is known as an RA or an ERA if you receive it electronically. But the differences between those are the remittance advice is more information and generally includes several patients. That would be more received by the billing office or a billing service. And again, it's going to include everything that is included within that check, all on one sheet that you receive. Whereas an explanation of benefit is something more that the insurance company would send direct to the patient so that the patient knows what the insurance company has paid. Of course, you would then enter all that information into the patient account, and it would allow for them to know what they are responsible for at the end. Generally, once you've got all that entered, you would bill a secondary if that would be applicable. If not, then the remaining amount due would be the patient's responsibility. And so, of course, you would then prepare a statement to send out monthly to the patient until the payment is paid in full. The monthly statements are sent out more so by office discretion as to a date and how that is structured. There's definitely many other duties that fall in between the consolidated information that I've offered today, but I truly don't have enough time to go into further detail about all the responsibilities of a medical biller. But being familiar with and having knowledge of the proper usage of the coding manuals greatly will help you in preparing a clean claim for submission. Of course, all claims aren't going to be perfect. You're going to get denials and pendings with minor issues to resolve. But the more that you produce without error, you're going to bring in checks more quickly, certainly, which is the ultimate goal. All of this can be accomplished by one person, as I do, or if you're in a larger billing office or a larger office that is a group of doctors, it might be broken down by separating the responsibilities out to different individuals or even departments. At the beginning of the speech, I mentioned that there are varied opportunities for medical coding and billing. Having that knowledge that I've mentioned will also allow you to be valuable to an insurance company or other facilities such as hospitals or nursing homes. And your options really are only limited by yourself. So if anyone would like to further look at the books and review them a little closer in detail, feel free to do so.